You don't know what you don't track. Very, very important. We see a lot of dental sleep medicine providers become discouraged to pursue dental sleep medicine because they feel like it's not working for their office. It's really important to understand whether it's not working or if it just needs work. Tracking is very important. You need to have data points where you can look at and say, here's where the weak link in the chain is, or here's where patients are falling through the cracks. Let's close up those gaps. Very important that you have those data points so you can analyze and make the necessary changes. It could be very small changes that need made in order to elevate your dental sleep medicine practice to the next level. But unless you have those data points, it's going to be hard to point out exactly what needs to change. Now, we can help you with that. We have an extensive analyzing dashboard that looks at all of this data, where patients are at in the follow-up process, where they're at in the workflow, your sleep workflow. It's important to know those things so that you can make the best decisions possible to advance your dental sleep medicine goals. If you need help tracking that data, if you want a partner who's able to help you make better decisions for your dental sleep medicine practice business, in the description of this video, there's going to be a link. You can click on that link and you can learn more about what we do here at Dental Sleep Profits, and we would be more than happy to have a call and talk about how we can help you track things better and get better results.